We are learning new, concerning details about the effects now of COVID-19 on the brain, which could be long-lasting.
A top neurosurgeon from Jefferson Hospital for Neuroscience spoke with NBC10's Wendy Saltzman about these newly identified risks.
You hear about evidence of some of the milder symptoms of COVID on the brain, like headaches or loss of taste and smell, but doctors say it's also causing an alarming increase in the number of strokes for younger and otherwise healthy patients.
Those are like working in spacesuits.
This is how neurosurgeons at Jefferson Health are walking into every emergency surgery, planning for the likelihood that patients they're treating could be COVID positive.
We don't know if the patient has COVID or not, and we don't have time to test because in stroke patients, we need to act right away.
Neurosurgery specialist and professor Dr. Pascal Jabbour is studying the effects of COVID-19 on the brain.
The effect of COVID on the brain can vary between mild symptoms to really severe and serious symptoms. Severe symptoms can be up to a major stroke or a brain hemorrhage.
In this exclusive interview, Dr. Jabbour is revealing his findings based on research from New York and Philadelphia that 30 to 40% of the patients treated for strokes have been COVID positive.
And those are patients that are young with no risk factors for stroke that are presenting with strokes.
So how does the virus travel to the brain?
When it goes through the nose, it follows the nerve called the olfactory nerve and follows it all the way up to the brain.
According to Dr. Jabbour, COVID can cause blood clots, swelling, and problems with blood flow to the brain.
Yeah, patients are recovering from COVID, but patients that are being affected by COVID and having symptoms in the brain like strokes, this is a permanent disability.
In terms of other long-term effects,
we really still don't know yet how much cognition is being affected.
If you're experiencing any of the symptoms of a stroke, like weakness on one side, drooping of the face, or slurred speech, it's imperative you call 911 immediately, because a stroke can come on fast, and the longer you wait to get it treated, the more serious the effects will be. In Philadelphia, Wendy Saltzman, NBC 10 News.
Back now to your NBC 10 First Alert weather. Take a